Really, my interest in mental health has really grown from family interest, so members of my family who have either worked in mental health or been service users. It's a real honour to be involved in the Mental Health Commission, and really what I expect of the role for myself as chair is to bring the conversation out and facilitate. There's a lot of people who have got expertise and experience from all different aspects, looking at all different angles. And my role as chair is to really foster that and encourage people to share their experience and their views. The Mental Health Commission is hosted by the West Midlands Combined Authority, and the aim of it is really to gather a wide range of stakeholders and perspectives together to look at mental health and see how we can create an environment where the West Midlands region can be really a positive place for mental health and wellbeing. What do we need to do to create those conditions, and how may we want to change the offer that would support that. Some of the topics that we've considered already have included children and young people in education, and children with special educational needs. And we are going to come back and spend a little bit more time looking at young people later on, because it is such a big and important topic. We've also looked at the role of sports and physical activity and the potential for that area as a contribution to mental health and wellbeing. And we had some really positive conversations around that. It was at the time when the Commonwealth Games was taking place in Birmingham and the surrounding areas, so it was a really great opportunity to capitalise on that. We're definitely going to be looking at cost of living, employment, the economic challenge and how that impacts on mental health, and what we could be doing about it. Clearly, we're not at the stage yet where we've finalised any recommendations. So what I personally have found interesting has been a real sense of the importance of looking beyond the formal structured support that is provided for established mental health service users, to go beyond that and look at wellbeing. And look at how we can take a more holistic approach that's more preventative and supports people to be well and healthy before they need to engage with mental health service provision. One area that I think there's quite broad consensus on from Commission members is around the sport and physical activity theme. So we were all really clear, and the evidence in terms of the response to the Commonwealth Games has just underlined that really, of the importance of sport and physical activity for mental health and wellbeing. The way that we're going to be approaching the next topic, which is about race and how that interacts with mental health in terms of access, experience and outcomes. It's a really important topic, but the way that we're approaching it is to align the work of the Mental Health Commission with the work that's happening with the Race Equality Task Force that is also hosted by the Combined Authority. So I think that's a really great opportunity to demonstrate how we're sort of working in synergy, not cutting across each other's work, but really benefiting from the different experience and focus of each of the members of those two networks.